it may be worth having a bit of a swap around between the two tables then, see where things are up to. Okay, I shall leave it up to you. And Max?
Okay, actually our table, we ended up on a very similar discussion, and that was about communication, about the fact that often work gets duplicated across the system, and the first time people discover that that work didn't need to get done is by accident when the client goes, oh yeah, didn't you know that, you know, X? And the communication between the systems doesn't work, and that's very frustrating for kind of frontline workers who end up having to
save a lot of time in the process, not the complaints process, safeguarding process. Thank you. And just kind of, if you can cut out that length of time, then you can address the issue much earlier because it's being highlighted to you.
We started the day with a simple question about domiciliary care and how we can improve the travel time between visits to try and costs.
Round of applause today.
And also, if cold and snowing, make sure they're warm, really pay attention to their health. So that can be This is the main crux of it.
a WordPress site. This exists. It's got, you know, it's the social care walkthroughs, so you can go home, look, social care walkthroughs. It actually exists. It's out there in the world. There are a couple of walkthroughs, you know, which we've already written, sourced within the group. One about access to work, one about, you know, supporting somebody within your family who's got dementia. Both of them just personal stories, personal
service. And this led on to the fact that providers already to some extent do this, and it could be improved, but it'd be a large and probably expensive process. But then the conversation kind of shifted into what advantages we'd get from an electronic system where you clock in and out. And we're aware there's already systems that do that, but what about the information you gather by using these electronic aids to domiciliary care? And how you could aggregate certain pieces of information that you might collect, and then from this information identify trends and commonalities to possibly lead to deterioration in health or increases.
In terms of what happens next, we are going to be having an unconference. So I'd strongly recommend replying back to that and join us at the end of April with it. I think we live in interesting times. It's so trying to everybody's been saying that. But I think we have a strategic opportunity at the moment to actually do something a lot different with the public sector. And I think in Liverpool there's a genuine appetite